Hi, I'm Dr. Joanne Giesenhaus with 𝒂𝗏 Chiropractic, and I want to talk to you about disc problems and what they really are, because sometimes they're a little, is it bulging? Is it a herniated disc? What is it? So let's really take a deeper dive in here too as well on what it's all about. So right here, I have a model of a low back spine, okay? That right here, I'm just going to lay that flat right here, is a picture of the spine right here on the big view down below here, okay? So there are these disc spaces, and you know what, you've heard that, right? Lumbar disc, I mean, it's so common, right? So we have these disc spaces that are in between. Now they're the cushion, right? So they're the thing that's called the shock absorption. Picture a sponge, right? A sponge that's really wet has a lot of cushion to it. A sponge that's really dry and brittle, it doesn't, right? So picture that in your head as I go along and describe it. Also, the other thing I need you to picture in your head is a jelly donut, okay? And what happens is, let's look at what a disc actually is. See, around the disc right here, you have this tougher area, okay? And what that actually is the strength of the disc, okay? So it's gonna be a little bit harder on the outside, but it's gonna give you a little bit of a bounce back. And then on the inside, it's like the jelly of a jelly donut, right? It's gonna be a lot looser. It's gonna be where that blood and oxygen and where that compressive force has to remain intact as well, okay? So they work together to nourish, strengthen the disc. What happens though is, if this is the crust of the jelly donut and this is the jelly, through wear and tear, through uncorrected vertebral subluxations, the spinal bones, which should be really nice, right here, you see them? Really nice and symmetrical and even. You see right here, they start to wear different, right? You can actually see little holes that start to penetrate the bone because it's no longer moving like it should. And as we actually move and we don't correct those subluxations, we can start to get that really rough edge. See that really rough edge? The disc starts to change in consistency. It actually gets brittle. And then it'll start to carve out more. Look at down here. Ay, that just looks like it hurts, right? And even as we go farther down the spine in degeneration, that disc space becomes so narrow. You've heard of it, bone on bone. So we want to eliminate. There's all stages in the spine coming through for phase 1, phase 2, phase 3, and really anything past phase 3 is actually spinal surgery and all those painful medications, those terrible opioids that seems to be, those prescriptions get written out, and we want to avoid those at all costs. So what ends up happening is, through that wear and tear, we have a healthy disc. It looks like this. But as we have that wear and tear, can you see how that disc, it actually starts to push out, like that jelly is squeezing out towards. And once that starts to happen, that disc is very weak there. You can start to begin to get symptoms. You might start to experience low back pain, maybe something a little nagging. Oh, it goes away. You don't really deal with it. Maybe you ice it, goes away. However, what happens is, if you don't get it corrected, you can actually have something that gets even worse, right? And that's when it actually pushes out. It can either push out and actually go up against that spinal cord. Oh my, is that a big ouch. That becomes very painful. You can start to get all types of symptoms there. That could even lead to the sciatica. That can even lead to other things like bowel problems, constipation, menstrual problems, digestive problems, all sorts of problems there. If it remains uncorrected, where you do not remove that subluxation, look at this. Ouch! That now is pushed up right against that spinal nerve. Intense pain. Sometimes that sciatica just won't go away. Some of that really radiating pain that is just almost has you doing nothing, right? So it's super important to never let that get to that level, and have your spine checked. And then, of course, if we go even farther, you're just seeing how that disc now is just flat. It's up against the bone. That's when we have that description where the doctor does say it's like more of a bone-on-bone problem. So what I'm saying is it's super important not to let your spine get to that point, and have your spine checked regularly to see if you have any of those vertebral subluxations, so we can locate them, correct them, and have you live the life you want to live. I'm Dr. Joanne Giesenhaus at Core Chiropractic. Thank you.